Hello, everyone. Thank you so much for joining us today. It is recording right now, and I just wanted to do a round of introductions. I see a ton of faces, so good to see you guys. I am Tisa. I am the program manager for CSVG. I have from my unit, Erica, who is the chief, and then I also have our new fiscal lead, that's Tracy Brose, who's joined us 2 weeks ago.
Hello.
And which means we can start doing RFRs pretty soon. Yay! You guys can you'll get paid.
Yay!
If you guys if you don't mind going around and kind of introducing yourself so that Tracy has a face to the many names that she will be working very closely with when it comes to RFRs. Thank you.
And Tisa, I can still see your screen, just so you know.
Oh,
there you go. Perfect. Yep.
Well, hi, Tracy. This is Lawrence Beasley. I'm with the Economic Opportunity Board here in Las Vegas.
I'm Mary Jane Ostrander. I'm with Carson City Health and Human Services.
I'm Janine Robinson with Frontier Community Action Agency in Winnemucca.
Hello, Leslie Colbreeze, Community Services Agency.
Hi, Corinne Smith with Nye County Health and Human Services.
I'm Jody Qualls, and I'm with Douglas County Social Services.
I think that's everyone. Maybe Jackie?
Sorry, I was finishing up on the call. This is Jackie Stewart, Churchill County Social Services.
Hi, I'm Tiffany Mazza, and I'm with Lyon County Human Services.
I think Kristen was on the call too, and she's from Churchill County. They're doing subtitles. Subtitles are showing up on my end, guys, and it's hysterical, like how wrong the subtitles are. Anyhow.
I can see them, yeah.
Okay, without further ado, let's get started. I have quite a bit of stuff I want to discuss. Okay. So federal updates. I have 2 slides. So the first slide is, as you know, the House Committee approved HR 5129, and they recommended for it to go to the floor for approval. Lindsay and I are following this very closely. The Omnibus Appropriation Bill for FY22 HR 2471 was signed into law. And if you look at it, CSBG, there's an additional 10 million, and the 200% FPL is, you can still use that till the end of September. And I have more information in the next little blurb about CSBG CARES and 2021 and 2022 for the 200 FPL. And in terms of the reauthorization of CSBG, no date has been set as of yet. POTUS just released their budget, and under the new budget, the CSBG is 554.2 million, and weatherization assistance is at 3.5 billion. Have you guys been following that?
Yeah, somewhat. That's a cut, right?
It is from the other slide, because that does say 755 and 742. 755 and 754.2. That I'm a bit unsure about those figures. So that was from the latest NCAP newsletter. So I will follow up with them. Sorry, Lawrence, I'm sorry I don't have a better answer for you, but those were the numbers.
That's okay.
And then again, for the 200% FPL, for FY21, which is your supplemental, you can use it till the end of this year, and then you can use it for FY22. for your FY22 for your base, which is end of this year too. If I am understanding the 200% FPL language right now. And I did clarify with NASCAP. Does
So
anyone
Tisa,
have? Mhm.
on the previous slide, it had opt-in. What does
You
that
can-
mean?
So if you don't want to, like, if you would rather revert back to 125% FPL, you can. So 200% FPL isn't mandated. It's an opt-in.
So we're gonna have mismatched folks for our annual reporting next year. Okay, never mind.
Well, for your cares, you have to do 200%, right? I mean, that was
Right.
one of the, but for the others, I mean, why wouldn't you opt in right now? Like why would you want to go back to 125% though, I guess?
Depends on where you live and what governor you got, I guess.
Oh, I didn't think about that, Lawrence. But it is an opt-in feature though. So,
All right.
okay, shall I move on?
Yes, please.
Okay. Does anybody else have any questions before I move? Because these were the only federal updates I had so far for you guys. Okay. GMU updates. Introduce Tracy, our new fiscal lead. I'm very excited. I've been working with her on some monitoring and she is fantastic. So very excited. Oh, okay. So FY20, so OCS has finally provided their comments from FY20 annual reports. I haven't had time to look at it yet. I am supposed to provide a response to them by the end of this month, which I literally just found out 2 hours ago. If there are any comments on the actual data for any specific CAA, I will reach out to you guys individually and ask you to provide a justification or even to resubmit a revised FY20 SMART form. I know this might potentially be a huge drag, but it's just, I have to respond to OCS. I'm hoping the comments are not extensive. Any questions? Okay, so the FY21 annual reports were submitted before March 30th. And there were some lessons I learned, which I'll go into detail on the next slide. But I do want to thank you guys for such timely submission. And it goes a long way in me doing my due diligence. So thank you so much. And I hope next year will be an even better experience. FY23 state plan, as mentioned, I want to include this bullet on every single one of our comms webinar. I think in May we're supposed to do an in-person board meeting, and I want to take 20 minutes of your time to kind of talk about the overall priorities of CAAs and making sure that they are included in our state plan. Does that sound good, guys? If you guys are nodding heads, I can't see. I will imagine that all of you guys are enthusiastically nodding heads. The last bullet here was that, and Lindsay can attest to this, there has been a huge push on the federal level to make sure that we, like for us, Nevada, we have 2 buckets of cares. Make sure that we spend down the first bucket, which expires end of September. Guys, I know I'm like an unbroken record, but if you guys don't think you're gonna spend your allocation fully for the first bucket, please get in touch with me ASAP. I will problem solve with you. We will find some other ways to spend down your allocation so that we don't have to return anything. Big kudos to Mary Jane at Carson. She reached out and we're pushing through an amendment to make sure that she spends down all her cares allocation. So please reach out to me. The goal is to spend it all down, not to return any money. Any Any questions? And I might, because of this, because of the huge push, I might be reaching out to you guys and be like, where are you at? Where is, you know, like, are you on track to spend down? I am meeting internally with my fiscal staff on Monday to look at the current snapshot. And I think I have included a snapshot, let me see, of where everyone is. But keep in mind that our vendor logs haven't been updated because we are really behind on RFRs. So this, I would say, is not really reflective of where you are, but this is what it looks like. And like Jody and Douglas County, like Jody, you will definitely have to make sure that you, because I know you had a huge purchase, the vehicle. We have to make sure that you definitely get that vehicle done before September.
Did you want me to chime in, Tisa, on it?
Yes, 100%.
We're still waiting because of all the issues we've had with ordering vehicles and the backup inventory they were waiting to fulfill. So I just checked with our fiscal representative yesterday, and we're hopefully still on track to get it in time. We're really pushing it and on our fleet services as well to get that vehicle going.
Perfect. I will, after Monday's meeting, hopefully I'll get a better look into what the spend down activity is for us for the first bucket. And then I will individually reach out to you guys and be like, come on, guys, we got to hustle. Yep. So, but that's what it looks like right now. Any questions?
I was just going to add a bit, and I know I put this in my slide deck as well, so a bit of repeating. But yesterday I sent out an email, and there was a really nice webinar today with the partnership and CapLaw and everybody kind of discussing this, and everybody's feeling a little bit nervous with how much money we have left to spend nationwide. I know Region 9 alone, we've spent less than 25%. So those numbers are definitely making people feel a little uncomfortable, and we want to make sure that this money is spent and it's spent well, especially as we're going into reauthorizing our CSBG bill. You know, it kind of looks negative, bad on us to say, hey, we got all this money, but we didn't need it, but we want to reauthorize this bill. So, you know, we just want to really make sure that we're able to spend it, because even though it is COVID specific, there's a lot that we can do with it. And I know Lana over at the partnership helped us and state association leads to create this spreadsheet that kind of talks about different ways to spend the money, creative ways, things that other people have done. So I included that in the email yesterday as well. Let me know if you didn't get it, or if you're just at a complete loss of, I don't know what to do, help me brainstorm. You know, happy to jump on a call, and I know Tisa is as well, to just kind of get some creative juices flowing on how we can spend this down. So be good to keep on track of it though, because I think right now we're only at 28% cumulative through the state. So
Lindsay, in my last OCS call, like quarterly call in January, they usually provide like, how is Nevada performing against national stats? And in terms of care spending for OCS, we were ahead of the curve.
Okay, good.
Okay.
Good. That makes, yeah, yep.
But I do want to mention, if we have to do scope changes, those amendments will be prioritized right now for care. So, I mean, like, this is top of my list right now, just to make sure that we spend everything down. So,
this is Corinne.
Yes.
I was on that webinar also earlier that Lindsay sent out, and they had some really good information, but they also put out 10 top ideas of ways that you can spend the money, and they're really talking that it's very broad. The spectrum is very broad on what you can spend it on. All you have to do is say it's pandemic related, which could mean even the inflation of fuel, or the fact that they can't get parts, anything like that. I mean, they're almost tying everything and anything they can into so that you can spend the money. And also the other word they used numerous times was flexible. But they're supposed to send out that PowerPoint. I think it would be really good to send out. I actually took pictures of the PowerPoint parts where it listed the top 10 ideas, but they had some good ideas. And there was even a couple websites mentioned on where they use, like one for getting packaged meals that the agency first started out giving to children when they were home and they were no longer getting the food for or free breakfast and free lunch. Now they're sending them monthly to seniors. So there's a lot of ideas, and I have that website even. So I just wanted to, it was actually a really good webinar.
Yeah, I agree. And I'll get those slides too, so I can send them out to everybody once they come in. Leslie,
great.
looks like Leslie's hand is raised.
Tisa,
Yes.
tell me how come I have a spend down of 20, number one, and the only one. And number two, how did you split between 21 and 22? Are we reporting it that way? Because I don't recall our reports being split by year. So it makes sense why I'm asking this.
Leslie, this is just the way the internal vendor logs are for our reconciliation. And
so is this the way it's going to be, or do we need to do something to correct it?
you guys don't have to do anything. This is just the way that our fiscal folks have set it up for them to keep track of the spending. Has nothing to do with you guys. I just look at, to be honest, I just look at the balance and the percentage and the grant amount. Those are what I look at.
So do you know what the 2020 is?
No.
Okay, good, thanks.
I have a new fiscal folks, man. Like, give me some minute to orient them, and then I'll be able to answer your fiscal questions. Sorry, Leslie. Any other questions? Okay. Lindsay, if you don't mind, when you share the deck and the recording, could you include me too? Because I missed it because I had the OCS call today.
Yeah, absolutely. Thank
you. Okay, I'm gonna go back to my previous slide. So that was the whole CARES thing, and I'm gonna go to some lessons I learned from this from FY21 annual reports, and it was kind of different because we had ELogic provide module 4. So one of my biggest lessons was that I need to provide very specific instructions to CAAs as well as to the camp team, and make sure that they're also, once I send you guys the smart forms, the onus is also on them to reach out to you guys and set up meetings to go over your module 4. They were a lot of discrepancies. Some modules 4 had a lot of errors, and the reason that I bounce back module 4s is because it's unethical for me at the state level to manipulate the numbers to make the math make sense. It's so unethical for me to do it, and it's a misrepresentation of the work that you do. And so I was pretty brutal this time in bouncing back module 4s that had errors in it. And to be honest, the onus is on the CAAs to work with ELogic, and I am keeping track of every single errors that are any data discrepancy that is coming from the ELogic system. I'm notating everything, guys, and there were some also errors built into the smart forms. For example, Lincoln County, Lindsay and I worked on the Lincoln County, all of the modules actually, and there were some errors that were built in, Lindsay, right, in the actual smart forms that we couldn't resolve. If there are errors built into the smart forms, after you guys go through and try to resolve the errors, please provide comments. almost all of you guys provided comments this time, and these comments are really useful for me too when I review the data on my end, and then I always attach it to Nevada's overall submission. I was hoping that OCS would have provided training on actually how to fill out module 2, 3, and 4, so I was very disappointed when they didn't. The trainings that they had provided, I thought were just, they could have done a better job. So I've taken upon myself to provide trainings for you guys in December and January. And it will be a series of trainings, and it will be how to fill out module 2, how to fill out module 3, and how to fill out module 4. These trainings will be recorded, and I think every year before the whole run for the annual reports, I will attach those trainings, those recordings for your programmatic stuff and for you guys to kind of like refresh on what needs to be done. Any questions, comments?
Yeah,
Okay.
this is Mary Jane. When you say the smart form errors or are built in with errors, are you talking about your right answer is not going to work because of the formula? Because I know I was struggling with the household income. You know, there can only be one income in the household, and that's not always the case. And so it just threw the numbers off of several. Okay, so that's what you're talking about. Okay.
Mm-hmm. There was one on insurance for Lincoln County that the math was right, but it still said it was an error. I think CAAs had an error where it just flagged it as an error, but it never provided an actual reason why it was an error. I think I can't tell if it was EOB or another one, but there were just some errors that were just built in, and OCS is fully aware of those errors. Okay, I'll move on. I don't think, oh, okay. So your base amendments, I have only received, I believe, 6. I will be pursuing the other 6 CAAs who haven't submitted their revised scope and budgets for your base amendments. We do have a new admin person who I will train next week, and so your amendments we'll start working on your amendments next week. Please bear with me. If you haven't submitted your CSBG base amendments, the revised scope and budget, please do so. And does anyone have any questions about that? Okay, and then CARES, we already talked about it. And I think this is the end of my presentation. Oh, wait, no.
Can we go back? Just a question, because you talked about the base amendments, and there wasn't a large amount. I'm just curious why you would ask for any kind of update to the plan itself, because they're so small.
So the scope is when we do amendments,
I'm not talking about the scope. I'm talking about the actual plan. So we have to do the goals, so to speak, not the scope, the budget scope, but the actual plan itself. So
the scope of work.
Yes. So why would they be updated when these are really small amendments? Does that make sense?
No, it wasn't. I'm not asking you to update the scope of work. I was asking you to attach your scope of work, because when we do amendments, we also attach the scope as well.
Oops, then I probably didn't do that. So
no, well, in your case, Leslie, I pulled your scope from your original NOSA.
Thank you. So I owe you another cup of coffee. Got it. Thanks.
So thank you for that question. Just to clarify, I am not asking you to revise your scope. Unless you need to revise it, if you do change anything in your scope, I'm just asking you to attach it when you send your revised budget narrative. If for some reason you forget, don't worry. I go back to your original NOSA and I drag it from there. And before I pass it on to Lindsay, do have a question about that was raised by Carson City in an email, and I just wanted to gauge what the other if the other CAAs have encountered this and what they're doing, but I'll wait till Lindsay's done with the presentation. Thank you so much, guys.
Thanks, Disa. Swap this over. Everything look okay? Yeah, can you hear me? Cool. All right. Hi, guys. I've got a lot of good news to share today, so pretty excited. Quite a bit to cover, but I'll try to breeze through it. Some of it might be a little overlap. As we know, the full House of Education and Labor Committee approved HR 5129, which is very, very, very exciting. So we're all very happy about that. Every single Democrat voted, and then 8 of the Republicans voted. So it's quite exciting. We currently have 110 co-sponsors, and we are looking for more, shooting to get about 125 by mid-April, so about this time. But I've been monitoring the NCAP site pretty closely, and as of this morning, it was 110. Along those lines, we are looking for some more endorsements for a letter that has been circulating. I sent an email out yesterday talking a little bit about this, and I know NCAP has been sending out quite a few emails. So kind of keep your eye on that. All it is, you know, is we're really just looking for people to sign on, show your support. You know, at a minimum, every community action agency should be on this, but please also send it out to people within your community that might be supporting this as well, you know, nonprofit partners, people that you work with, any sort of organization really, the more the better. So there is a link in that email yesterday. I can try to put it in a chat here when we're done talking, but it takes all of 2 seconds. It's like your name, your email, what agency you're at, your position, I think, and then it's, do you support this, yes or no? So really quick, there's a Google Doc that I've been following, and we only have a few people that have signed on from Nevada thus far, and I'd love to see that number increase. So please, 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 if you got 2 seconds, would love to show some love and more support for this. It's got, you know, a potential to have a huge impact on us, especially being a small state. So if this passes, we have a good likelihood of having some more money come our way, which is great. Echoing what Tisa said about our CARES spending, I think we've talked about it enough, so I'm not going to repeat everything I said. I will send those slides out to everybody when they're sent to me. So probably tomorrow, I'd assume they'll get over our way, and the recording as well. But it was a great webinar, wonderful resources available. Please, please, please don't hesitate to reach out if you are unsure of what to do with your money. Just another reminder, I know it's April already, which is wild to me, but we have Deborah Campbell on retainer to help us with strategic plans and needs assessments until the end of this fiscal year. So if you're needing any help in either of those categories, please reach out to me and I will connect you with her. It's a wonderful resource. We've got her now, so please use it. We want to be able to assist you in those departments, and we won't have her forever. So reach out now. Very exciting next news. I talked to KPS3 yesterday. We had a really good meeting. They've come up with some logos for us that they're thinking about using as we're doing this rebranding, revamping our website. So there's a handful here. What I think our best step is will be to vote on these. They've given me some wonderful language as to what they're thinking with each different logo. As you can see, of course, they're in black and white right now, and they won't be that way moving forward. But just, kind of very nitty-gritty baseline of where we're at. But look out, I'll be sending an email in the next few days with some slides that talk about each logo and the meaning behind it, and then would love if everybody could vote on what they like the best, and then we can move forward with that. But really, really loving all the work that they're doing for us, and would love to get your input too on what you guys think best represents us as a whole. A little bit along those lines, as a few of you know, the Cal Kappa team has been helping us with our social media accounts since, gosh, maybe August or a bit earlier than that. Anyways, they had some changes in their funding structures and they are no longer able to assist us. They had to do some staffing changes with some budget cuts. So if you see a lag in our social media, please know that I am doing my best to keep up with our Twitter and Instagram and Facebook and all of it. But without their help there, you might see a little bit of a dip. So I am not a social media queen, but I will do my best to keep us updated on all of that. I sent an email out a few weeks ago. We've got a upcoming Intro to Roma training. It looks like we've got quite a few people signed up already, which is great. Please, if you can sign up by May 1st, that would be wonderful. I've gone ahead and I've pre-ordered 40 books, which should be enough. What I'm planning on doing is those people that are coming to the board meeting in person, I will give you the books that you need for your agency on that day. Otherwise, I will be mailing those out to you probably in the first week of May. It did look like there was a handful of people that had signed up. In the bottom section that I wrote on there, if neither of these dates work, let me know. So I did see, I think we've got 4 or 5 people in there. I'm going to try to tie you in with a different training. It might not be specific to Nevada, but I'm going to talk to Barbara Mooney and PJ and see what else they have going on. I know they're doing some trainings for Arizona and California right now as well. So if I could plug you into some of those, that would be good. And the association will definitely pay for all of that and your book. But bottom line is we'll get you trained up in this. So looking forward to that. If anyone has any questions, please just stop me as I ramble. Board meeting reminder, May 12th in Carson City in person. I was gonna ask, so I don't think Shannon's on this call, I can't see the participants, but Shannon was a little concerned that 1 p.m. might be too soon. I know there's a NACO meeting that morning. Those of you that are attending that, what are your thoughts? I know we touched base on it during our last board meeting and we thought 1 p.m. would be fine, but I certainly don't want to rush anybody or have a conflict in meeting times. Anybody?
Well, this is Mary Jane, and it could be, we're having several different state departments there to give updates and stuff and just kind of have a roundtable discussion. And we try to have that happen like once a year, but the last couple of years we haven't been able to. So I mean, I'd hate to cut that short. Corinne, what do you think? Or
I agree. I think it might be pushing, because I think that part of it's probably going to go for, well, if everybody shows, a couple hours.
Right.
So
Yeah,
does 2 p.m. make sense? Like pushing the board meeting to 2?
That would work for me, and we've got the room blocked out for that day. You know, because I want you guys to be able to have like 20, 30 minutes in between meetings to breathe. That's important. So just, yeah, let me know what everybody thinks. I didn't want it to be a conflict. If 2 o'clock works, that works for me.
I think that would be better, but I don't know, we can check with Shannon and see if or if Jackie can check with Shannon when she gets back and see if she thinks that would be enough time. I think that would be enough time. How long can state employees talk, Tisa? How long can you?
We like to filibuster.
Okay.
I think the roundtable starts at 10. So I would
Yeah.
think by 2, you guys should be finished.
I would think so.
Okay. Okay.
So I do have, I just have a couple of points about this. So the last board meeting in person, the state, I presented my communication webinar. We merged it too, like we merged it together just to make it convenient for you guys. I did receive a feedback from a CAA that told me that they didn't like the communication webinar from the state to be merged within the board meeting, because the board meeting is for executive level folks, and they really wanted more programmatic people to be part of the communication webinar. And I just wanted to throw it out to the floor. Like, is this an issue for all CAAs? Like, if I merge the communication webinar within the board meeting? I'm hearing crickets, guys. I need a consensus.
For Carson, it was fine, you know, for us, but
Lawrence, Janine, Jackie, Leslie.
Yeah. It was okay to me.
It was okay with me. I was on it remotely for both meetings, and the little break in between was fine with me.
And I think it was fine with Churchill. I don't remember Shannon saying anything that it wasn't. And then I didn't have an issue, so.
We didn't either.
So I'm going to go with the majority and just keep merging it with the board meetings on the months that we have the NCAA board meetings. Thank you.
Perfect. Sounds good. And then are we all in agreement that 2 o'clock would be okay for us to bump this back an hour on the 12th? Does anybody not agree with that? Okay. I'm going to take silence as an okay. I'll update that calendar invite. And then those of you that can't make it in person, there's a Zoom link attached to the invite as well. A little ELogic updates. I know everybody has been getting their client diagnostic reports, or I hope so. Been working a lot with Tiffany, who has been providing those reports for us. We're going to start having, please don't cringe too hard. We're going to start having a monthly meeting talking about our client diagnostic reports. I know everybody is very busy and meetings are the last thing you want. But what we really want to do is make sure month by month that we're looking at the report, right? Because what happened and what we're finding is that at the end of last year, when we were doing our Module 4 reports, you know, we're finding a handful of discrepancies. And then at that moment, it's so overwhelming to look back on 12 months of information and data that you've collected and start going through it then. So I'd really like to stay on top of this as much as we can and touch base month by month, just to make sure that, you know, our data is being put in correctly, that things on the backside with ELogic are happening correctly, and that just eliminate these discrepancies between what we're inputting and what's being shot out with these reports. With that being said, not all executive directors need to be on those meetings. It's totally fine if you have a programmatic staff member that is, you know, your ELogic specialist, so to say. They can take lead on those meetings. That is fine with us. But we just want to make sure that that we're moving forward appropriately and that our data is clean and that we're proud to present it at the end of the year. So kind of along those lines, I've got the report, and this will just kind of back up what I'm saying from the aggregated data from the beginning of fiscal until now. So just a short little example, we've got about 9,800 people that have been put into ELogic, and of that, 4,000 of them have not been assigned a client type. So it's things like that that we just want to kind of button up a little bit and to make sure that there's no loose ends between ELogic and the agency. So look out for those meetings. I know a handful of those have already happened, but those of you that have not seen an email about that, you'll be seeing that soon.
This is Heather with Lyon
Trevor
County.
has
I'm
her
excited to
hands up.
hear about this because I'm a fan of ELogic, and I believe in the possibility and the potential of the purpose of this being a functional case management tool. So a question I have about these monthly reports, is somebody from ELogic going to be present to these meetings?
Yes, 100%.
Okay. I'm glad to hear that. And I do want to share that we have our client diagnostic report today, right after our meeting, right after this meeting. So I just want to have a reminder of that, because I know we're working hard on making sure that we're all at a good spot with our data entry and our report execution, especially because our company, our agency, is putting FRC and CSBG into ELogic, which I think continues to give us opportunity to improve.
Yeah, absolutely, absolutely.
Thank you.
I'm glad. Yeah, I'm glad to hear that you like the idea of it. And you know, having it be monthly is something that I want to do now. If we get to a point in a few months where our client diagnostic reports are clean every time and everything's looking great, I'm happy to move them to quarterly. But I think there's just a few little things that I'd like to button up a little bit in the next few months with the agencies overall.
And I just think it's important that someone from ELogic, they are present, so it's not, we're all hearing the information at the same time and moving together.
Right, exactly, because you can tell me all day and I have no ability to go in the backside and fix anything. So it'll definitely be probably Tiffany. I don't know if Ben is going to be on those calls, but Tiffany and myself for sure. Maybe Tisa if she's got the time, but everyone's busy, so no worries on that.
Lindsay, I think the challenge of not having been on there is we're not getting a whole lot of information from that side of the house, and Tiffany can't answer that. I understand that, but I think part of the opportunity is we'll get back to you on that. Doesn't necessarily happen. Does that make sense?
Lindsay,
Yeah.
I just wanted to jump in and say, like, Tiffany has been working with us for a long time. And I think, to be honest, like from my experience of being on calls with Tiffany and Ben, Tiffany has a better grasp of what's happening in Nevada, data collection wise, than Ben does. And I will be on.
I don't disagree with you, Tisa. I'm not talking about that. I'm talking about the questions regarding just because again, if we can't run reports off of the Looker dashboard and we go in and try to recreate that to look at and make sure that it isn't missing something, because that's the only way to do that. In other words, if we see that something is of error, we have to go into ELogic, and she can't answer how is that data pulled over so that we can run apples to apples when we're going into ELogic to verify that data. She couldn't answer that. So that's part of the challenge, because she's not writing that script. Ben is. You understand?
I see what you mean. Okay, so you mean like, okay, I get it now. Like the back end script. That would actually be Adam, to be honest. Lindsay. So that's something like for some of the CDR calls that you're in, if it's questions like that, how is the data being pulled, then maybe Adam needs to be a part of these calls instead of having having Tiffany be like, I'll get back to you.
I think both, because Tiffany is good at giving other information, very good. It's just the other pieces that she can't answer. Does that make sense? And I'm sure she's busy, but we don't necessarily get that. We'll have to get back to you answer.
Yeah.
Listen, guys.
Lyon County, and I totally second that, because we have experience very similar.
Well, that's true, Heather. We've been working with you and with some of your stuff. I've been on those calls. Listen, guys, If ELogic doesn't get back to you on some pending question, please loop me in. I will make sure they respond to you. I will, havoc hailstorms upon them if they are not responding to you in time. So please loop me in. There is something that some CDR and looker parameters, Lindsay, that we, do you want to talk about that?
Yeah, I was going to touch base on that. Those of you that were on the meeting or on the call yesterday talking about the looker dashboard, there was a little bit of a discrepancy between what was being reported in the client diagnostic report and what was showing up on the looker dashboard. So I talked with Tiffany about that because I had some concerns too with statewide data and just not really understanding how those numbers were being pulled. And to simplify it, what she said was the total population, right? So you're on the looker dashboard and it says number of clients served within a certain time period. So that is just new clients specifically, right? And so your client diagnostic report here, right, under total population, that is the number of clients new and current, right? So for the statewide, we had about a 4,000 person discrepancy. And I was like, listen, if I'm using the looker dashboard as a way to tell a story, I need it to show every single person that we are currently helping. If I'm saying, hey, Nevada is this fiscal year has currently helped X amount of people, I don't just need new clients, I need all clients. So she agreed with me and Tisa agreed with me as well. And I hope everybody on this call does too. So what we decided to do was change the parameters in the looker dashboard to include all clients, new and current, that we're currently serving. So those numbers should then be the same with your client diagnostic report. So the total population in your CDR will equal the total population in your looker dashboard. So I hope that clears things up a little bit for people that were on that call yesterday. She did say that it would take a little bit of time to go ahead and change all of that configuration on the back end. But for me, that made more sense and it seemed to be a more accurate representation of what we're doing as a whole, not just new clients started within a time period.
And it is all clients within a given time period, like within a given year. I just want to make that distinction.
Yeah.
So can I ask a question?
Uh-huh.
I was kind of split between two different meetings yesterday, but this goes all the way back to what I've been saying about how ELogic has to work with us to make sure that there's common singular definitions for what services are, what clients are, and how they're all defined, including what you created in that glossary, TISA, so that everybody knows what's being represented and how you actually pull that data in order to generate these reports. Otherwise, camp ends up making decisions about what should be reported that ends up on the looker pages, which is different from our client diagnostic reports.
Actually, Lawrence, I'm so glad you brought this up, and I'm smiling because Lindsay and I, so we have the lexicon, and we sat with Ben and Tiffany, and they looked at all the different services that all the CAs provide. And Lindsay and I have a huge task where we're going to make sure that the list of services that you guys are currently using aligns with the lexicon, the CSBG lexicon that we created. And we're going to also define them, whether it's a family service or an individual service. And then we are going to share that revised lexicon, which will encompass every single services, but it will be streamlined. So like EOB might call it bus pass, and then Nye County calls it something else. Everything will be streamlined, and the state will be asking that all CAs moving forward uses these comment like these approved service names. Does that make sense?
Yeah, I think what we want to get to is having the lexicon reflect the data collection, the names of the data items, and then how do each of those data items show up, not just in client diagnostic reports or looker reports, but how are they reported on the module 4 as well?
Yes.
So
Yes, we intend to do that, Lawrence. And this will be a joint effort. All of you guys, I will need all of you guys' feedback as we present these revised lexicon to you. And then ELogic, once we approve it, ELogic is going to go in the back end and clean up all the data, like all the different, once we say bus passes, this is bus passes overall, ELogic team will go and clean up all the data, but we'll also make sure that historical data isn't lost because the service has, the name of the service has been adjusted.
Mm-hmm.
Okay.
Yep.
Yay,
and it should
Lawrence.
be out in the next 2 weeks. Yay.
Well, Lawrence, give a thumbs up. Yay.
I can't see anybody. I feel very blind right now. Okay, carrying on for more wonderful news in our world. RPIC and OCS has extended our RPIC funding. Yay! So I know a few months ago I brought this up. They were kind of on the fence if that was going to happen or not. I know within the network there was a lot of uneasy feelings. We've had a million meetings about it, but last Friday they came out with a letter that officially said that they're going to extend our funding for another year for the region. So I highlighted here that. So that's the same amount of funding we've been getting for the last few years, but it's pretty exciting just because we were on the fence about it for quite a while, actually. And that's a good chunk of the association's funding. So very happy to have that again moving forward. So exciting, exciting news. We've got some trainings coming up. So I think we are, let me check time, coming up on our hour here. So I won't drag this on too long. All of this information in here, this last bit, I will send to you in an email. So yeah, you've got the links to click on to register if you want to do any of these trainings or webinars. NCAP has a War on Poverty workshop coming up. Big reminder, May is Community Action Month, so very excited there. NCAP sent out a toolkit last week, I believe it was, for your socials, so please use that if you can. We're going to do a big push on our end here at the association level, but at your agency level, try to share a little love as we're all community action agencies, and it is our month to shine in May. Let me know if you didn't get that toolkit. I can send it on to you. NCAP has some trainings and webinars coming up. Like I said, I'll send this all to you. I won't go through it line by line. There's another training coming up by a consultant that actually Leslie sent me the information for, so thank you for that. She's got a lot of good training. So financial management for community action, CEOs and finance directors. That one's coming up next week after. There's a risk summit, virtual risk summit, which we've currently got going on. So there's 3 different sessions for that. It is completely free and paid for by the partnership. The first one has already happened, but I'm sure you can still jump on to the next 2 if need be. And it is conference season. So we have hand conferences coming up. NASCAP conference is in October. We have the CAP Law conference in June. We've got the Whipsley conference coming up in July. And then the NCAP conference is going to be the end of August. So look out for all of that. Early bird registration is going on for a lot of it. NCAP conference has not opened early bird registration yet, but I'm sure they will soon and we'll all know about it. But just keep those in your calendars if you feel like going, if these are things that you would like to attend. the association will be helping with some travel for the NCAP conference, so look out for details on that. I don't know if Jackie's still on the line, but we've had some questions regarding vaccination requirements for some of these conferences, and I've reached out to the partnership to ask, and I haven't heard back yet. So I'll let you know what their decision is this year. I know last year that they mandated it. I'm not sure if they're going to go ahead with the same policy as they did last year. So more to come on that. And let's try to change this. And that was it. Yes. Any questions or comments? Pop back out so I can see everyone's faces again.
Thank you, Lindsay. That was fantastic.
Yeah.
I know we have just a few minutes left, but I would love to pick your brains on this issue that, so I know Mary Jane left, but Carson City had an individual, a client that came in to seek help, and they were questioning. So you know how in the demographics you have male, female, and other, and this was a person that's transgendering, and I think there was a bit of like hesitation on what they wanted to fill out. I haven't heard anything in the federal level about these conversations that should be happening. Have you guys encountered where clients have come in and if they asked you or questioned like which, like should they fill out as male, female, or other?
This is Heather in Lyon County. We have had this a couple of times and the individuals have selected other, but I would say for us in the last year, maybe about 3 or 4 times.
Yeah, it's probably been about the same here. Well, maybe a little bit more because we deal with Hopper clients, but they don't like picking other, but they pick other. Yeah.
Okay, so that's the thing. I don't want them to feel forced to pick other. And Carla also said Carla and Kaz has said that they usually just ask them to fill out what they feel comfortable. I will address this question with my OCS counterpart, but it's very interesting, like whether we should have another spot, like for another spot saying transgender. So I will let you guys know. Thank you for letting me pick your brains about this. We are on the hour. Thank you. So guys, this is a long one. Stay well. I am always here for you, as is Lindsay. Ping us, call us, email us, and we will be in touch. Bye, guys.
Have a good day. Bye, guys.
I need to